Hey everyone, hello and welcome to Tuesdays with Tina. It is Tuesday, October 29th, or is it the 30th? I don't even remember. I guess I should probably double check the date. Anyways, yes, it's Tuesday, October 29th. And today on Tuesdays with Tina, I will be reviewing the incisive injection. And, there's a lot of different reasons why this injection was one of the ones I wanted to talk about today. Well, one is I haven't really done a deep dive into an injection in a while, right? Where I just go through, I got Mr. Skull here. I got Mr. Skull and go through and review some of that. But also, the incisive injection is one of those ones that it is a hallmark one. It is a regular one that many dental hygienists do. So we'll be doing that today. And I've got Instagram over here. Hello, Instagram. Happy to see you guys live. And then we have a YouTube live over here as well, which is where all of the Tuesdays with Tina live. So if you're ever curious, like what else has Tina talked about, you can go to the Teacher Tina RDH YouTube channel and visit the playlist that I have there of all the Tuesdays with Tina, especially for this year. And there's some really good ones on there, especially when we're talking about mandibular injections and angulations as well. So just wanted to give you that heads up. And for those of you that are curious of what else I have going on, I know last week I was out. I took some time off, did a little bit of vacation time. And then prior to that, it's just been a lot of travel, going back and forth to Georgia, doing some anesthesia certification. So I will be there again, not this weekend, but next weekend. This weekend, I will be here in my home state with the Oregon Dental Hygienists Association, and I get to be the keynote presenter for that. I'm really excited getting to share my thoughts and topic on creating your professional masterpiece. So I think that's kind of fun. Alrighty, let's dive in, shall we? Okay, good. And if you have questions, comments, anything where you are like, hey, I want to know more about this particular injection, whether or not I don't review it today, if you have a particular topic you'd like to know more about, please put it in the comments, okay? Would love to have that, which would be cool. Alrighty, so the incisive injection. Now remember, the incisive injection, this is one of those ones where it will anesthetize the mandibular premolar to premolar. That is what it's designed for. Now, if you grew up in the era that I grew up in, when I was a hygiene student, we learned it as the mental injection, right? It was the mental. And because it is right over the mental foramen, you can see it's like right over that mental foramen. I'll show you guys here too, that mental foramen. And you deposit the anesthetic, and it's supposed to get the lower anterior premolar to premolar numb, or whichever side you inject it on. So if we do it over here on the right side, that would take care of the right side there. Now, over the years, the name has changed from being the mental injection to being an incisive injection. And there's really only one key difference in that. There really is. Your technique is exactly the same. Your positioning, your deposition, everything is exactly the same. The big difference between the two is applying pressure. So you apply pressure right over that mental foramen to push the anesthetic into that foramen, which makes the anesthetic flow into the canal. Let's see if I can do this without dropping Mr. Skull. Okay, so it makes that anesthetic flow right into that foramen and bathe that incisive nerve, which lives deep inside the mandible. So when doing this injection, there's a couple of key things. Now, I'm literally, you guys, I am doing a deep dive into this injection, and I don't normally do this. This is something that is usually saved only for those who are a part of any of my courses and have access to these videos, okay? I will say that my book that's getting ready to be published, the PDF version will be available actually in about a week and a half. So the PDF version will have the deep dive videos into these injections, but I just wanted to give you guys this special treat. So when you're doing this injection, the things that you want to be aware of are, one is identifying where that mental foramen is on your patient. Now I've got my little pretend needle here as well. So you want to find that mental foramen on your patient. Alrighty. And so you're going to feel for it. You can feel it externally. And if you take a moment, you can just feel it on yourself right here. It is going to be near the lower ridge of the mandible, kind of near that premolar zone. And if you take a look here on Mr. Skull, Now, again, this is not a real skull, right? This is a medical model, but you can even see just how close it is to the lower border of that body of the mandible, okay? You can see how close it is there. And if you feel in your own face, you can feel that area. And you can might even feel like a little zing, a little bundle of nerves kind of go ding, 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 right into your premolar, maybe even to your canine. You can feel there. Intraorally, now you can feel intraorally. You can pull your patient's lip out. You can pull your patient's lip out and feel down in the mucobuccal fold. You can feel down into that mucobuccal fold, and you can feel for that little bundle of nerves and blood vessels that come out through there as well. Now, when that happens, you might feel almost like a little ropey string-like sensation to the touch. Okay, your patient again may feel a little bit of a twing or a zing sensation. It's not like the zing that we would feel like when we give an injection. It's just more of like you can feel the pressure in the tooth. Okay. So that's how you're going to find it. The other thing is look at your radiographs. You can look at the radiographs and see if the patient has a nice mental foramen right on your PAs. Great spot to see it. Panos, if you got a cone beam, you can evaluate the placement of that mental foramen there. And if worst comes to worst, it's generally usually most of the time right between the two premolars. Okay, so you can always just go, I'm just going to go for those premolars. Tina, I don't know what you're talking about. I don't feel it. I just don't know. So if you just say, I'm just going to go between the two premolars of the mandible, you're probably going to be okay. All right. Now, when you do this injection, I prefer to stand at a 12 o'clock position. So I have my patient's head like right here, like this. Okay. So my patient, I will be looking down over them coming in. Now there is a method where you can be beside your patient. Sorry, friends. Got a messy office too. Okay. I'll work hard. I don't have time to clean up my office. You can be beside your patient. Okay. You can be beside your patient and come in an anterior fashion this way. Okay. Where you're coming in and inserting. Now, the reason why this is not my preferred method is because of stability. I tend to see that stability is more challenging if you come from an anterior fashion. I know from a patient's perspective, right, that seems a little less innocuous than coming right over the patient's head. But you can tell your patient to close their eyes and you can just sling it right over, just come right over, okay? Alrighty. I'm feeling around now. Somebody just said, I'm feeling around my mouth right now. I think I have tori in the way. Yeah. So some people may have exostoses. Isn't it so funny? Like we're like, if it's on the cheek side, if it's on the buccal side, it's exostoses. If it's on the lingual side, we call it tori. Those bony extensions. If you have a patient that has those exostoses, especially in that area, not very common. Usually we see that more on the maxillary area. That you'll just have to pull the patient's lip out a little bit more. And speaking of pulling the patient's lip out, retraction is important. You want to really pull the patient's lip out in a way where you're creating a bowl of that vestibule. Okay. And I'll show you again my mouth. And you know what, you guys, like all of the pictures that you see of anatomy usually is my mouth that I've snapped a photo of. Okay. Yeah. Pull out. Look at how much room is in that vestibule when I do that. Okay. So you want to create a lot of room in the vestibule so you can hold the patient's jaw. You're going to hold the patient's jaw. You're going to retract with your thumb and almost have like your fingers underneath their mandible. And then you can come in. Got my little practice needle in here. You can come in and just so the A's can see, I'm going to continue to hold the skull this way. You come in and rest right on over. You can even stabilize with your pinky on the patient's skull right here or on their glasses. Also, don't forget, give yourself a tripod stance with your syringe, okay? I'm not flipping anybody off. I know it kind of looks like it. I was like, ooh, am I being mean? No, I've got my tripod stance right here. And you're going to come in and insert right over where those premolars are. Just 3 to 6 millimeters you'll insert. aspirate, and then deposit your solution. Now, depending upon which anesthetic you're using, really is one of the dictators to how much solution, also what procedure you're doing as well. One of the things you'll notice with your incisive injection is you might see that tissue starting to balloon. Okay. Generally, like I would say, if I'm doing, the incisive injection to do bilateral, right? Because the patient has really sensitive lower anterior teeth. There's a lot of deposit. I want to take care of that, and it's just in this zone. I would do a bilateral incisive injections. My go-to would be 4% articaine with 1 to 100 or 1 to 200 epi, depending upon the patient's cardiac status. And then I would give maybe a half of a cartridge each side, one full cartridge for both. When you do that, you're going to see the tissue expand. It will bubble up and expand out, almost like a water balloon being filled up. You'll see something like that happen. When that happens, it's totally okay. It doesn't mean you're doing anything wrong. Now, if you aspirate and you see that you've got a positive aspiration and you ignore it and you continue to go, you may see some of that ballooning up. Also, it could be, a nicked blood vessel. You want to pay attention. Like if that tissue ballooning starts to happen and it's turning purple, then we're concerned about a hematoma. Okay, so if you see that coloration change, now normally what you'll see is the tissue color doesn't change. You just see this expansion or this almost kind of like you no longer see that deep V of that mucobuccal fold. You will see that happen. Cap your needle. After you've made your needle safe, maybe given your patient a rinse, is apply some pressure to that zone. Just apply that pressure there. That's going to push that anesthetic into that mental foramen so that it can bathe the incisive nerve that's still deep inside the mandibular bone. That's what you want to do. You want to make sure you finish off that. If you don't do that, you're going to have the patient's lips going to be nice and numb. Maybe a little bit of their facial gingiva will be pretty numb too, but their teeth are still going to be sensitive, and their teeth are still going to be very, very sensitive. If you want to make sure that they are good to go, not feeling anything, push and massage that anesthetic in. Now, as a bonus, if you are using articaine, which I love articaine, my friends, it's one of my favorite anesthetics. If you are using articaine and you're doing it with an incisive, the way that articaine is formulated, it will pass through the thick cortical bone of the mandible very easily, which means we may also get some nice lingual anesthesia as well. Right. One of the things that can be really frustrating is when we do bilateral incisive mental injections is that we don't necessarily always get profound lingual anesthesia. Beautiful thing about if you're using articaine. Trade name is Septicaine. If you're like, Tina, what's articaine? If you're like scratching your head. A lot of people will call it Septicaine. It's the same thing. Articaine is the generic. Septicaine is the trade name. You can get some great lingual anesthesia with that. Okay, so somebody just says, I always call it the mental incisive injection. Yes, right. That is a very common, a lot of people will call it the mental incisive, which is not wrong. It's totally not wrong because you are getting both nerves. You really are. It's just like some people call it the IA injection. Some people call it the IAL injection because you're doing the inferior alveolar and the lingual nerve. Right. So I think that's totally wrong. Totally okay. There's nothing wrong with saying mental incisive. Just the key difference, if you want to make sure you are including the incisive, is applying that pressure so that the incisive nerve actually gets bathed with the anesthetic. All right. Okay, friends. I hope you enjoyed that deep dive. And again, if there's anything where you're like, I'm curious what else Tina's talked about, just go to the Teacher Tina RDH YouTube channel and you can see some great, oh, you're welcome, Jill. So see some great reviews. One of my favorites that I have on there, I have a review on the PSA, which, that is like the bane of most people's existence because it's geometry and motion, all the angles, 45, 45, 45, 45. But also there's a wonderful video, which I really like a lot, which reviews mandibular injections, especially our nerve blocks, and the angulation differences we have to make if we contact too soon, if you don't contact at all, what that looks like and things that you can do to adjust that. So that's it, friends. I will see you guys. I will see you next week. I don't know what I'll chat about. If you have ideas, if there's something that you're curious about, send me a message. And if you happen to be in Oregon this weekend, please come to the Oregon Dental Hygiene Association, and I'm happy to share. I still have to write my presentation. I've been writing it, but I have to finish the final touches to it. I'm pretty excited. Oh, and if you're like, Tina, what else do you do? If you're curious, you can always join me with some of my fellow friends with Dental Post. We started a podcast called Dental Bites. It's me and Amanda Hill, Kim Bloom, and Allie Morgan. We kind of called ourselves the hygienists of Dental Post. Anyway, we get together and have quick little chats, like 10, 15-minute chats, just about hygienists, talking about products or what's happening in the operatory, maybe not even what's happening outside of the operatory. So I invite you to join me there as well. All right, friends, thank you so much. See you next week. Bye.